Hey everybody, the deadline to get your application in for the spring vintage of Village Global Accelerator is March 1st. Companies that have been through the accelerator have raised from some of the best venture funds in the world like A16Z, Lux, Spark, Bessemer, Founders Fund, and many more. Learn more and apply at villageglobal.vc/accelerator.
Hey everybody, it's Erik Torenberg, co-founder, partner of Village Global, a network-driven venture firm. And this is Venture Stories, a podcast covering topics relating to tech and business with world-leading experts.
Hey everybody, welcome to another episode of Village Global's Venture Stories. I'm here today joined by returning guest and fan favorite, Nikhil Krishnan, and new guest, Owen Willis, who's recently joined the On Deck team and is leading On Deck Health that has just launched today. And I must say, I got introduced to Owen thanks to Nikhil. So Nikhil, thank you for helping us make that happen.
Love when two of my friends hang out. It's my favorite thing in the world.
It's great. I feel like we're coming full circle on this podcast. So I'm excited.
Exactly.
So let's start out. Owen, why don't you sort of give we're going to get into On Deck Health and what we're doing, but maybe you can give a backdrop, maybe just on when you think of how health tech and digital health have evolved over time. I know you have an interesting sort of framework or mental model for how you think about it. Why don't you start by unpacking that?
Yeah, of course. So I think for starters, like the history of health tech is also really the story of medicine, right? Like there's been advances in medicine kind of going from the ancient Egyptians, all the way through the CRISPR work that's being done today. And so, I think for the purposes of this conversation, really focusing on advances from like the 40s forward, right? And I think there are some big inflection points that have happened that have really moved healthcare and health tech forward during that time. I mean, I think the first is obviously the development of the transistors in the 1940s, right? We wouldn't have pacemakers if not for the ability to have electronics be small enough to fit inside the human body. The development of the polio vaccine, right, which was the first mass inoculation. And just as kind of like an aside, like my mom had polio when she was a kid, and now 2 generations later, it's gone. And that's really kind of the first time in human history that's been possible. But then also when we think about health tech, we think about investors and investing in the space. And that really kind of comes down to Kleiner Perkins investing in Genentech. They were actually a seed investor in Genentech when that was first launched. And then, kind of the other big movements in tech, right? We have the creation of the World Wide Web. We have smartphones, things that give consumers more power over their data and more access to information as it relates to healthcare. We have the proliferation of electronic health records, things that allow for better kind of collection and usage of patient data. And right now, I think Epic has 54% of patient health records in the US kind of within their system. And then, most recently, I think COVID-19, right? The pandemic of this past year has been a huge shock for the healthcare system. And it's led to unwinding of a lot of regulations that people have been really pushing for a long time that have now happened in like a matter of weeks. And so, everything from training for healthcare workers to how we deliver care, rules around telemedicine, all of that stuff has changed because of that Black Swan event.
Yeah, that's a great background. Nikhil, let's turn to you. You cut your teeth as an analyst at CB Insights studying the space, and you've been studying it for quite some time now. What have you seen as sort of the biggest evolution, more recently in perhaps the past, decade or eight years or so, as it relates to building a digital health company in terms of how the environment around it has evolved?
Yeah, I wanted to talk about the ancient Egyptians too. I feel like I'm getting shorted. No, so I mean, yeah, I think Owen gave some great sort of historical context and how it's sort of shaping up now. I think I'm a little bit more familiar with the more modern, like the more stuff like for when I've been working in healthcare. So, I think that historical context is really helpful for me too. But in the last, I would say, decade or so, I think there's a few ways to think about it. I think one is how business model evolution has sort of happened. So if you think about like 2008, 2009 as really the start of the Affordable Care Act and kind of how that has been sort of playing out. It's really been a 10-year experiment, and that's everything from moving just generally away from fee for service to experimenting with different types of value-based care arrangements. And, we still see a lot of new ones popping up. Like, for example, more recently, there are things called direct contracting. A lot of companies building in areas like Medicare Advantage. So a lot of interesting experiments on the sort of value-based care model space, and then also just sort of an explosion in cash pay willingness. So we see a lot of consumers actually willing to pay for better experience out of their own pocket. So one shift, I think, has been a business model shift. I think a second is also that I think from V1 to V2, we saw a lot of new infrastructure layers built that make it easier to start a new healthcare company. And to me, I think that's actually really one of the more key shifts, at least in the last 5 years or so, where now you can basically build a new company off this like stack of APIs that exist to really just spin up a quick one. So for example, if you want to do pharmacy fulfillment, you can hit up TruePill and they'll handle all that for you. If you want to check for insurance eligibility, you can use Eligible. If you want a telemedicine consult plugged into your workflow, you can use Wheel. So you can spin up companies really quickly now. And that kind of reminds me of sort of V1 of general tech, where you saw things like AWS and all that kind of stuff make it much easier to start a new tech company. It really feels like now that services or healthcare services specifically have been sort of reduced to almost API level calls for a lot of things, that you can now build a lot of new businesses today. So those are, there's obviously a lot more that's happened in the last 11 years, but those are like two I think, of the big shifts that are worth thinking about.
Yeah, that's helpful. Oh, and let's turn to you. The program, among other things, which we'll get into, is helping get health tech companies off the ground and helping people transition into the industry. Why don't you talk about any misconceptions people may have around the industry, or just some of the unique challenges that digital health founders face?
Yeah, absolutely. So I think one of the most common misconceptions that we have in the healthcare space and kind of with people building health tech companies is just the idea of it being a meritocracy, right? Like that the best or most novel solution in health tech wins. And that's definitely not true. I think a lot of phenomenal products, never see the light of day for a number of different reasons in the health tech space. And part of that is that success in health tech is very much tied to outcomes, right? So it's reducing cost, improving quality of care, saving time. It has to be something that's measurable. And actually the product itself in many ways becomes the business model for the startup and has to in some way hit one of those potential outcomes that's going to help either a provider, a payer, or a consumer. As part of that, actually selling into the healthcare system becomes like a very relationship-driven thing. People are making decisions around adopting new products, especially products from startups. They're taking a huge career risk by pushing for the adoption of a product, right? If it goes badly, they could get fired. And so it takes a lot of time to build that deep relationship on the sales side and to set up a pilot and do these things to be able to prove outcomes so that you're able to actually effectively scale and sell into these large institutions in this space. And just kind of as a little an aside, one of my own personal experiences was selling into healthcare systems. And one of the things that was incredibly powerful for us was thinking about the person who you were actually selling to as your guide through the organization, right? So they're the ones who's kind of leading you through the bureaucracy of that sales process. And your job is really to kind of give them the tools and the resources to look really, really good to their peers and help them in their own career as well. And that's kind of how you're able to make those sales. And so just kind of as part of that, like it's super important for these early stage health tech startups who are selling into the B2B space to get pilots, to really manufacture success as part of those pilots, put a ton of resources into, making sure that is going to have the outcomes that you want from it, because that is what's going to get you paying customers down the road. And then I think one other kind of big misconception is just around products related to delivery of care. It's really easy to kind of fall into the trap of like solving for the patient, right? Instead of making the patient and the patient experience kind of front and center to what you're trying to do with the product, right? They are the most important part of the care team. And it's a big part of building successful products in the health tech space are building products that are going to improve the quality of care for those patients.
Nikhil, any reactions to any of that, or any things you'd add in terms of what's different about building digital health companies that founders should know?
Yeah, I think that touched on a lot of good ones. I think I especially want to just double highlight the best product doesn't win thing, because it's unfortunate, but the real key thing is that in healthcare it's sort of just rife with the fact that the buyers of products and the users of products are two different entities all the time. So because of that, the buyer doesn't really care about the usability and the experience. So product doesn't always win. I mean, I don't even know what the conceptions coming into healthcare are anymore. It's like, other than, oh, it sucks. I think some main ones are like, one, no one actually is incentivized in the healthcare system today to make patients healthier. That's just like the reality of the situation. I think everyone comes in, they're like, oh, if we just made patients healthier, let's solve all healthcare. It's like, yeah, but the problem is no one really wants to do that. And that's for a lot of structural reasons. Largely, I think, flowing out of the fact that you change your provider and your insurance company and your plan all the time. So that's one problem. The second is, and I guess related to that, is that almost no one in healthcare cares about reducing costs. They care about increasing revenue. That is a very key thing to understand. Obviously, it depends on which part of healthcare you're selling into, but for the most part, most of these companies are not trying to reduce their cost structure, either because from a regulatory perspective they cannot, or two, because it looks way better to say you're a low operating margin business that is sort of providing care than one that's saying we're raking in profits, right? So because of that, people care more about expanding revenue. And then I think the last thing I would just say is that this might be a little bit counter to some of the things Owen said, but I'll just say I don't think there's as much excitement from people in the existing healthcare system to use new tech. I think just generally tech rollout in healthcare has been really bad, and that can be tainted by EMRs, which are just a generally notoriously terrible experience. A little before what we were talking about the fact that good products don't win, and so bad products actually end up getting rolled out to the users, and they're not thrilled about it. They don't want one more thing that they have to do, right? No one is the same way tech people are foaming at the mouth over Notion or Roam or something. That doesn't exist in healthcare, where people are oh my God, I just have to use that new tool. It just doesn't happen as much. So
yeah, and I would agree with that. I mean, I think there's a lot of reluctance around rolling out these tools, and right, I think you look at something like Epic, you ask many doctors, and there's been lots of kind of stories written about this in different publications, but using Epic actually increases the amount of time doctors are spending on paperwork, and it's actually making their jobs in many ways more difficult. So I think there's definitely that challenge, right, where you have these people building really interesting, exciting things for an audience that is just going to be more skeptical about adopting them. And so I think that is definitely a challenge. And that's where I think the relationship piece in terms of that selling process is so important.
Let's transition into the fellowship itself, because we've sort of been dancing around it a little bit. Owen, why don't you talk about what the purpose is, who should be a part of it, and what they might expect to get out of it?
Yeah, absolutely. So I think as we were thinking about putting this fellowship together, it kept coming back to a question of access, right? So, as we've discussed before, healthcare is exceptionally complex, and there's lots of regulation. And so I think for a lot of founders, there is a lot of known unknowns when it comes to the things that they need to be doing and building and filing in order to launch their product successfully. So, expertise is one access point. The next access point is, sales and sales enablement, right? So the connections to the right people who can kind of help you grease the wheels to actually close, your first or second pilot in the space. And then the last piece is access to capital, right? If you're not able to prove traction, if you're not able to kind of close those initial deals, you're not going to be able to raise capital. And so, those were kind of the three main things that we thought about as we were starting to put together the OnDeck Health Fellowship. And so, what we've designed is essentially a 10-week program for startup and healthcare experts who are wanting to found, join, invest in, or advise health tech companies. And so we have a curriculum that we've put together that provides these folks with the resources they need in the space. But then we also have speakers and office hours and folks that we're bringing in who are going to provide lots of really, really tactical feedback for founders and people looking to advance their careers in healthcare.
That's awesome. Let's sort of give a preview of like where things are headed. Yeah, I'll start the question by asking you first, Nikhil. Why haven't there been any $100 billion startups in the last or even 10 billion startups in healthcare in the last decade or so? It's a multi-trillion-dollar industry. People like to say, what's preventing sort of the big decacorns and plus from emerging?
Yeah, I mean, I think for one, there have been some actually in the last year or so. If you look at Teladoc, Livongo, I think you see some of those cases actually pop up. I mean, I think there's a couple. I mean, I think there's a bunch of reasons, right? Like one reason is that structurally, because healthcare, I think, depends very heavily on distribution as part of the advantage. It becomes actually way easier to sell into a lot of companies that can basically juice your distribution as sort of part of your growth strategy. And so for a lot of companies that are small, it actually might even make sense to fall underneath a larger sort of parent company umbrella than it is to try and build your own distribution from scratch, which is a very, very daunting process. And candidly, like we don't really, I think unlike tech, which has seen new distribution angles pop up in the last decade, you haven't really seen the same in healthcare to the same degree. You can argue things like mobile and, the web generally have done that, but it's really isolated because again, the person who's looking at the mobile ad or downloading the app is usually not the person paying for it, right? So even though you have distribution to the users, the reality is like if they're not paying for it, then you don't see a ton. That's going to hamper your valuation growth. I will say the other thing is also healthcare businesses, for one, take a long time to really grow into their valuation, and also with the last year excluded, there hasn't really been the same zeitgeist of like, hey, we will like forward fund your revenue multiple into your valuation because the businesses are structurally way more expensive, and it's way harder to understand what the growth story is in a lot of cases. I think COVID has really actually changed that drastically, where it's way easier to understand it's way easier to sell a story of like how you're going to grow into your valuation. There's a lot of money flowing into the markets that are just new to healthcare that's really excited to sort of like figure out like where they should be placing bets. So yeah, I mean, I think that's part of it. I would be surprised if in the next 10, 15 years, we don't see more 10 to $50 billion healthcare companies kind of pop up because I think that's probably the range that you would expect to see some of the current companies hit those numbers or new distribution angles to sort of be opened up to either from new regulation, et cetera, to kind of enable those kind of opportunities. So I think you'll see it. I think it'll get there eventually. I think one thing important to highlight in healthcare is we've never seen a platform in healthcare. This is not, unlike areas in tech where platforms became huge value creation engines and also themselves then becoming $100 billion companies, et cetera. And I define a platform as something where third parties can basically build on top, and then the aggregate value of those third party applications are more valuable than the platform itself. But when you think about healthcare, you don't actually have platforms, right? You would think something like the medical records would have been a platform to launch off of, but that hasn't existed because they largely are more deploying custom solutions per client. And that's kind of the model that they've chosen. And I think in the next decade, you will actually see platforms. And I think platforms are an important part to companies growing into large valuations.
Which is really interesting, Nikhil, because I think, a few years ago, there was kind of this big kind of people were really harping on there's this push for Epic being a platform, right? Sure. And kind of having companies build out their solutions into Epic, but obviously that hasn't kind of paid the dividends that people were expecting.
Yeah, I think it's complicated. I think a lot of the interoperability rules that are coming into play this year actually should incentivize more platforms to be built, or more, just more data sort of liquidity generally, which will lead to platforms. And then I also think just the fact that you have like a mass of patients who are now for the first time probably have signed up for a healthcare app in the last year just because of nature of the pandemic will probably actually allow for people to build platforms just by nature of like high consumer sort of usage. So we'll see. I mean, I'm hopeful for it.
If you were to guess, who do you think is best positioned right now to build or deploy a platform like that?
I mean, I think the first one will be some sort of personal health record. It's sort of impossible to tell who the winner of that is going to be, right? There's a lot of different strategies to doing that, which like, hard to get into in a short podcast, but it's like, I think personal health records will probably be the first platform to emerge. But you can also see an area where like either the personal health record itself becomes this, where it's or a standalone company builds what looks way more like a marketplace between the person providing the services and the individual consumer buying the services. I think it's actually this is more just personal speculation. I think it'll either start from the data side of things, where it's a personal health record that flows into a marketplace that you can you take that data where you want to go, or the second side of things, which is you start from the finance side of things and you say, hey, maybe it's like the HSA is the wedge, maybe it's a payer that's the wedge or whatever, where you say like, hey, we are basically going to be the rails that actually enables sort of this marketplace to get built on top, right? So I mean, if I look at someone like Oscar, for example, it's like I'm now getting deals from Oscar for like other third-party healthcare services and applications, right? Yeah, your boy signed up for like some virtual fitting room classes to finally burn off this pandemic weight. But I think more seriously, like it makes a lot of sense that the people who control the wallet, the purse, or the payment rails would eventually also want to be power the platform.
Totally. Owen, how about you in terms of what we can expect looking forward and maybe drill down a bit in the healthcare delivery side?
Yeah, for sure. So I think, kind of building on what Nikhil was talking about there, I think we're seeing a lot more innovation models around the actual delivery of care and kind of optimizing the experience in healthcare, especially for traditionally underserved communities. And so I think a lot of that has been due to what we mentioned before around changing regulations, making it much easier to get access to care, making the billing process more easy. And so, we're seeing a lot more companies in the telemedicine space, lots of improved back office functionality in healthcare, things that impact quality of care, like the ability to more easily follow up with patients, and then just overall improved care management, right? So it's not just a prescription getting prescribed. It could be, kind of the follow-up after the fact to make sure that they are actually sticking to their health plan. And I think there are a lot of companies in the space that are doing some innovative stuff around that.
Yeah, I agree with that. Do you guys have like interesting areas you'd want entrepreneurs to come to On Deck with as ideas, or are you sort of open-ended to like thematically where people are building companies?
I think we're pretty open-ended thematically. We have a pretty good range of both founding fellows and speakers, kind of going from folks who are actually kind of doing some of that back office work. We have Pear Team that came in. We have folks in the deep tech space, which we didn't touch on too much, but I think that is a place where there's lots of interesting work happening. Again, like one of the things that I'm super excited about is, COVID is obviously too obvious an answer for like why now, but like we're discovering a lot of the cracks in our healthcare system because of COVID, right? And I think, in the especially kind of in the biochem space around drug discovery, I think that's a big place. Improved methods for disease diagnoses, kind of more rapid testing, and then things around like advancements in the storage of vaccines and cells and other things, right? Making that, just making so we don't have to use Dippin' Dots to distribute an effing vaccine. So, that's where I'm really interested in getting some companies in.
Let's wrap here. This has been a great conversation, guys. Nikhil, can you please plug Out of Pocket and your community and where people can learn more about your work? And
totally, yeah, I'm trying to help teach people how healthcare works at outofpocket.health. It's everything from a newsletter. I got some crash courses coming. I got a children's book about how clinical trials work. So a lot of things that are very tangentially related to each other, but not at all. But yeah, if you want to learn more about healthcare works, you can find me on Twitter at Nikhilanet. You can hit me up on Out of Pocket. You can, call me, text me, beat me if you want to reach me, and I'm down to chat whenever.
And I must say, I've read Nikhil's blog from cover to cover. It's fantastic. We did a whole separate episode going deep on a bunch of the articles, so definitely check both of those out if you're interested in what you heard today. And Owen, for people who want to learn more about the fellowship.
Yeah, so we're going to be, I think, officially announcing today. So that's super exciting. So definitely check out the On Deck Twitter feed at Be On Deck, as well as the website, beondeck.com/health. If you're interested in building a company in health tech, we really want On Deck Health to be that place for you. We think it's going to be the best place for founders and healthcare experts to go to deepen their industry expertise, accelerate their careers, and build impactful health tech startups. So check us out and apply if you're interested.
Yeah, no, that's great. The only thing I'd add to it is also for people who are looking to transition into the industry or get great startup jobs. This is the place for you as well. Nikhil, Owen, thanks so much for coming on the podcast.
Thanks, Erik.
Thanks, Erik. Thanks, Owen.
If you're an early stage entrepreneur, we'd love to hear from you. Check us out at villageglobal.vc.